Oral care for ICU patients. Objectives are: the nurse will summarize the steps involved in oral care for ICU patients, the nurse will demonstrate proper oral care for the ICU patient, and the nurse will discuss the importance of proper oral care for ICU patients. These objectives were based on the comprehension tier of Bloom's taxonomy, which includes knowledge, comprehension, and understanding. Before viewing this PowerPoint, we would like for you to follow these instructions. Please take the pre-test, view the PowerPoint slides, review the demonstration video supplied at the end of the PowerPoint, and please return to SurveyMonkey to take the post-test. According to Sage Products, hospital-acquired pneumonia included ventilator-associated pneumonia originate in the oral cavity. So when we think about VAP, we have to include dental plaque or biofilm that lodges in the mouth and multiply, that causes these pathogens to be aspirated into the lungs, which lead to infection. Oral care provides patients comfort, reduces dental plaque and mucosal inflammation, and also promotes oral health. Biofilms are a thin layer of microorganisms that form and coat the various surfaces. They have usually been found to be involved in up to 80% of infections. Dental plaque is one of the most prevalent biofilms and responsible for various oral health issues, including gingivitis. So anybody that is in the ICU that has poor oral health, such as dental caries, rotting teeth, or gingivitis or periodontitis, you should clue in to be more aware of doing oral care a little more often. Why is oral hygiene important? Ventilator-associated pneumonia is the most common infectious complication among ICU patients and accounts for 47% of all infections. This means that the patient has a longer hospital stay, and unfortunately, Medicare and Medicaid do not pay for these infections. Not only do you have to worry about oral hygiene with your ventilator patients, think about some of your patients who can't necessarily protect their airway, including dysphagia, stroke patients, patients who have cancer, or patients who have COPD or on BiPAP long term. These are a couple of conditions that you may want to associate with doing oral care a lot more frequently. And most hospitals have a protocol with doing oral care Q2 or Q4. Just follow your agency's protocol. Statistics. Ventilator-associated pneumonia has a mortality rate up to 76%. Mean hospitalization costs were up to $99,000 for patients with ventilator-associated pneumonia. So what does this mean for the patient? It's an additional 10 days on the vent, an extra 6 days in the ICU, an additional almost 12 days in the hospital. For the patient, that means an increased cost, increased length of stay, and also don't forget, Medicare and Medicaid do not pay for any type of nosocomial infections. Now that means that cuts into the budget. We as CNL students must think about the budget. So in order to decrease the cost, it would be better to do your oral care Q2 or Q4 to help reduce the incidence of ventilator-associated pneumonia or hospital-acquired pneumonia, depending on your patient population. Recommendations for oral care. Now, when assessing a patient for oral care, make sure you use your nursing process. So, assess the oral cavity. Look to see if there's any open sores, any type of abscesses, rotting teeth, any type of foul odor that's coming from the mouth. Use your best nursing judgment. If you see that a patient has open sores, do not use, lemon swabs or glycerin sticks. You want to assess the patient. Make sure they're not on thrombocytopenic precautions. It is recommended that you brush the teeth, the gums, and tongue at least twice a day and use the chlorhexidine rinse. Use a soft, compact head toothbrush. Now use your nursing judgment. Look to see if there's any type of sores, and you want to use that toothbrush to help break up the biofilm and use the suction. Your mouth is already a perfect breeding ground for ventilator-associated pneumonia or hospital-acquired pneumonia because it's moist, it's damp, and it's dark. So using that suction helps to remove that biofilm. Also, with brushing helps to remove that plaque. Using an oral chlorhexidine gluconate rinse twice a day in intubated patients help to reduce the risk of VAP, and also suctioning above the cuff or inside the oral cavity will help reduce your risk. Oral chlorhexidine gluconate rinse should be used at least once a day, along with oral care for non-intubated, acute, and critical care patients. And you want to apply the oral moisturizer to the oral mucosa and lips every 2 to 4 hours. And that also helps to reduce the incidence of pressure injuries, especially if you're working with somebody that's intubated. Providing moisture will help decrease the risk of pressure sores. Supplies needed to perform oral care include toothbrush, toothpaste, suction, gloves, toothset, and CHG rinse. Remember your institution's protocol about oral care. And you also want to make sure as a new nurse to gather all your supplies that is needed for oral care. Time management is of the essence. For the procedure, set up your suction equipment. Position the patient's head to the side or in place in semi-Fowler's position. Provide suction as needed. In intubated patients, remove the oropharyngeal secretions that can migrate to the tube and settle on top of the cuff. Brush the teeth using the suction toothbrush and small amount of chlorhexidine. Brush approximately for 1 to 2 minutes and exert gentle pressure while moving in short horizontal or circular strokes. Gently brush the surface of the tongue. Use the suction swab to clean the teeth and tongue if brushing causes discomfort or bleeding. Place the swab perpendicular to the gum line, applying gentle mechanical action for 1 to 2 minutes. Turn the swab in clockwise rotation to remove mucus and debris. Apply your mouth moisturizer inside the mouth. Apply lip balm if needed. Stay tuned for the demonstration video. Oral care in the intensive care setting. Please remember to wash your hands, wear gloves, and use 2 patient identifiers. Please gather your supplies. Remove the kit from the bag and hang it at the bedside. Next, remove the packet containing the single unit dose of CHG oral rinse. Remove the bottle of oral rinse, peel open the package, and remove the suction toothbrush and attach it to the suction line. Pour the bottle of the oral rinse into the toothbrush package and dip the toothbrush and brush the patient's teeth and oral cavity. Next, dip the untreated swab in the CHG oral rinse and swab the patient's mouth. For oropharyngeal suction, attach the catheter to the suction line to remove oral secretions above the cuff. For the next cleaning, remove the suction package. Before opening, burst open the cleaning solution to dispense the solution. Peel open the package and remove the mouth moisturizer packet and set it aside. Remove the suction swab and attach it to the suction line to swab the teeth and oral cavity. Repeat with the suction swab as needed. Tear open the mouth moisturizer packet, squeeze onto the applicator swab, and apply liberally to the patient's lips and inside the mouth. Use the yonker to remove oral debris and secretions. When finished, make sure to rinse with sterile saline or other solution to clear the line. Please gather your supplies. Tear open the package and remove the components. Remove the single unit bottle dose of CHG oral rinse. Peel open the package. Pour a small amount of the oral CHG rinse into the package and dip the toothbrush and have the patient brush their teeth. You may need to assist the patient and have the patient rinse and spit the remaining CHG oral rinse. Again, do not swallow the CHG oral rinse, and the untreated swab can be used for additional cleansing.